Do you have enough hip mobility for your squat? When you go towards the bottom of your squat, your hips need to rotate and your muscles and tissues need to be able to stretch throughout the. La, 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 la. Do you have enough hip mobility for your squat? When you do a squat, your hips need to rotate, your muscles need to stretch, or you're going to feel pinching, you're not going to have as much control, and you're not going to be able to lift as much weight. Let's do a couple tests to find out. First, we need hip internal rotation. We often don't think about this in your squat, but at the bottom, your hips actually rotate inwards a bit in the socket. If we don't have enough rotation, we often see the knees come in as we come back up, or you might feel pinching in the hips. To test it out, lie on your stomach, on your bed, on the floor, on a bench, and let's see what your hips can do. So right now my hips are at 0 degrees, and as my feet go away from center, I can measure the angle between 0 and my hip internal rotation. As you're doing this movement, engage your core, lengthen your lower back so that you don't have any compensation. Take a screenshot of this, if you're taking a video, would be ideal, and see what's the angle between neutral and your hip internal rotation on each side. As you internally rotate, the pelvis should not move so that you can isolate what's happening only in your hips. Hopefully you have at least 30 or 35 degrees. Some folks need even 45 degrees. See what your number is. Next, let's look at the hip flexors. So you need to sit at the edge of your bed or a box or a bench. If you're taller, you need something much higher. I'm 4'11", so this is totally fine for my body. Sit at the very edge like you're about to fall off and pull one knee to your chest. Straighten the other leg and lower your leg down towards the floor. We can look at a lot of different things here. For starters, do you have any pinching in the top hip? That might be a sign that your lower back and pelvis just isn't mobile enough. So take note of that. Number two, with your legs straight, can you lower your leg to the horizon, even a little bit below? If so, then you have adequate hip mobility. Ideally, your leg can go at least 10 degrees below the horizon, but I would take at least horizon as adequate. Then bend your knee. As you bend your knee, can you keep your thigh still, or does the knee pop up? If you can keep your thigh on the horizon and bend your knee 90 degrees, I'll call that adequate quad flexibility. If your knee pops up or you can't bend your knee very far, then likely you have tension in your quad. If you can't get your leg down, then you have tension in your hip flexor. So test on each side. If you're videoing, take a screenshot of both the straight leg and the bent knee version and see where you're at. So is your hip pinching when you pull your knee to your chest? Can you lower your leg with the knee straight? And can you bend your knee? Take note of all three things.